Welcome, Royal Court, to the importance of oral hygiene. Disease starts in your mouth. You will not find this lesson in your workbook. This is a supplemental presentation, and I hope you enjoy. Years ago, a physician who suspected heart disease would probably not refer the patient to a gum specialist. The same went for diabetes, pregnancy, or just about any other medical condition. Times have changed. The past 5 to 10 years have seen ballooning interest in possible links between mouth health and body health. In one recent study, people with serious gum disease were 40% more likely to have a chronic condition on top of it. Oral health equals overall health. We've known the health of your mouth can influence your overall health for quite some time. A healthy mouth has billions of good bacteria living that influence the health of the teeth and gums, and good oral hygiene, such as brushing your teeth and flossing every day, help keep the bad bacteria at bay and keep your gums healthy. Brushing and flossing not only help remove the bad bacteria and the other things that erode your gums and teeth, it also improves circulation to your gums, which improves the health of the tissue. The improved health of the gums helps your immune system ward off pathogenic bacteria and viruses like HPV. When your gums become inflamed or even worse, eroded as in periodontitis, the bacteria have an express way to the circulatory system through tiny cuts. Many researchers and physicians speculate that this may be one of the causes of heart disease. Bacteria that typically live in the mouth have been found in plaques in the heart and arteries that cause heart attacks. Bacteria that belongs in the mouth also causes inflammation when it gets into other parts of the body, setting off a cascade of immune reactions that lead to clotting and inflammation. Inflammation is well documented to be an underlying cause or at least contributor to hundreds of chronic diseases. Oral hygiene plays a critical role in whole body health that is sadly overlooked by most doctors. As a frontline shield against systemic inflammation, one's oral status profoundly impacts diseases ranging from heart disease, type 2 diabetes, and cancer to rheumatoid arthritis and atherosclerosis. Let's take a more detailed look at a few of these conditions. Oral health and diabetes. Let's take a look. The working relationship between diabetes and periodontitis may be the strongest of all the connections between the mouth and body. Inflammation that starts in the mouth seems to weaken the body's ability to control blood sugar. People with diabetes have trouble processing sugar because of a lack of insulin, the hormone that converts sugar into energy. High blood sugar provides ideal conditions for infections to grow, including gum infections, and fortunately you can use the gum disease-diabetes relationship to your favor. Managing one can help bring the other under control. So heart disease can start in your mouth. Gum disease is an infectious inflammatory condition caused by bacteria growing on teeth in the form of a dental plaque biofilm. These infections, which can last for decades, put enormous stress on the immune system. Destructive microorganisms, inflammatory compounds, and poisonous waste materials from destroyed bacteria, which are endotoxins, can all seep from the mouth and circulate throughout the body, creating a systemic hyperimmune and inflammatory situation. In the bloodstream, periodontal bacteria can invade susceptible arteries and defective heart valves. The bloodstream swarms with antibodies against these common oral microorganisms, but as the disease progresses, the antibodies also attack damaged tissues. Did you know that the plaque that develops on your teeth is the same plaque that causes heart attacks? The most common type of bacteria in dental plaque can escape into the bloodstream, travel through the arteries, and result in blood clots that can cause fatal heart attacks. People with periodontal gum disease are nearly twice as likely to suffer from heart disease, and this is according to the American Academy of Periodontology. And the following diseases have been linked to plaque: bacterial endocarditis, and this is a condition which the lining of the heart and heart valves become enlarged. COPD, which is chronic obstructive pulmonary disease. In addition, a study conducted by the Boston University School of Dental Medicine stated that people who are missing some or all of their teeth that's due to periodontal disease are at an increased risk of having a stroke. Gum disease and obesity. Yes, some researchers are now suggesting that periodontitis may contribute to obesity by elevating C-reactive protein, which then acts as a potent inducer of inflammatory cytokines and hormones secreted by adipose tissue. Scientists have found that elevated C-reactive protein causes fat cells to store more fat and burn less energy. Indeed, evidence is accumulating that there is a link between obesity and periodontitis. As one research team noted recently, obesity is a significant predictor of periodontal disease, and insulin resistance appears to mediate this relationship. A University of Mississippi study found significant correlations between body composition and periodontal disease, and noted this finding strengthened arguments that periodontal disease and certain obesity-related systemic illnesses are related. Prevention is the key. Most oral diseases are preventable. Tooth decay affects 1/4 of U.S. children ranging in age from 2 to 5, and advanced gum disease affects about 4% to 12% of the adult U.S. population. For the best oral health, brush your teeth at least twice a day. Concerned about irritants in your toothpaste? Sodium lauryl sulfate is a foaming agent added to most toothpaste that actually cause irritation in sensitive individuals. So look for a toothpaste free of the sodium lauryl sulfate, and check out the safety profiles of other toothpaste at the Environmental Working Group. Also use a mouthwash. This helps to strengthen the enamel of the teeth and prevent decay. And again, look for ones that don't have additives in it. Floss or use oral irrigation every day. Flossing helps to remove the microorganisms that get trapped in that dark, slimy, warm crevice of your mouth and cause decay. Try oil pulling. Now, this might be new for some of you. Oil pulling is an old remedy that removes toxins and bad bacteria from the mouth and improves gum health. People who do it report whiter teeth, better breath, healthier feeling gums and teeth. To do it, just swish or pull between your teeth. 1 tablespoon of vegetable-based oil, my favorite obviously, is organic coconut oil. And it says to do it for 20 minutes, but you know what? Any amount of minutes in the mouth is a good thing, making sure you get your gums nice and coated as well. Now, after pulling, you're going to spit the oil into a trash can, rinse with warm water, and or brush your teeth. Let's talk about oral irrigators, or what I like to call water floss. Like most other parts of your body, your mouth contains what's considered both good and bad bacteria. Therefore, it's important to use a method to rid your mouth and gums of these bad bacteria while also not eliminating the presence of good bacteria in the process. This very fact is what makes oral irrigation such an effective tool in treating and preventing gum disease. Most dental professionals recommend oral irrigation as a way to clean both your teeth and gums, eliminating bad bacteria and flushing out food particles that often cannot be reached by brushing alone. Oral irrigators use a pressurized stream of water to gently flush both bacteria and food particles from your mouth. Likewise, oral irrigation can be used to flush the infection caused by gum disease, and it works to keep the issue in check by keeping your gums clean. Recent studies show that oral irrigation is an effective way to treat even advanced gum disease gently through the use of oral irrigators. Now, we've already talked about oil pulling, but let's look at it just a little bit more. To perform it, you simply swish an oil in your mouth, pulling it between your teeth for about 20 minutes. But like I said, any amount of time in your mouth is going to be a good thing. And again, you can use a number of oils, but my favorite is the coconut oil. And the benefits: it's one of the easiest ways to support your oral health naturally, especially using the coconut oil, because it's a powerful destroyer of all kinds of microbes, from viruses to bacteria to protozoa, many of which can be harmful to you. Ancient Ayurveda texts claim that oil pulling may cure about 30 systemic diseases, and even today it's widely discussed as a tool for detoxification of your whole body. I highly recommend it. And the reason that I highly recommend coconut oil for the oil pulling is that it has an antibacterial and antiviral activity that makes it especially well suited for oral health. In fact, coconut oil mixed with baking soda makes for a very simple and inexpensive yet effective toothpaste, and research suggests it may be a valuable tool for fighting tooth decay. Candida and Streptococcus are common residents in your mouth, and these germs and their toxic waste products can contribute to plaque accumulation and tooth decay. Oil pulling may help lessen the overall toxic burden on your immune system by preventing the spread of these organisms from your mouth to the rest of your body by way of your bloodstream. Many people think oil pulling sounds strange until they try it. Then many become hooked. It's just one more way they can use a natural, simple substance to significantly boost your oral health. People have been using these techniques and others like chewing sticks for centuries because they work. So are there any side effects? Well, it is a detox, so people seem to experience the following between the 2nd and 7th day mark of oil pulling. Some have sinus drainage, runny nose, sore throat. 2, they have trouble waking up in the morning from such a deep sleep. 3, sometimes there's acne from the detoxing effect. Number 4, fever. Number 5 is that the sink and drains can get clogged if you spit it in there, so make sure you spit it in a trash can or out in the yard. So clearer skin, whiter teeth, healthier gums, better health, I think it's worth it. Now let's talk about how CoQ10 actually helps to fight oral disease. Now, it's best known as a potent cardioprotective nutrient. CoQ10 also has been shown to improve symptoms of periodontitis when applied topically in the oral cavity. Japanese researchers conducted a placebo-controlled clinical trial in men with established periodontitis. After 9 weeks of CoQ10 application, investigators found evidence of significant improvements in periodontal status, which were not seen in the control subjects. An early study of CoQ10's effectiveness against periodontitis impressed the study's authors so much they wrote healing was so excellent 5 to 7 days post-biopsy that the biopsy sites were difficult to locate. The healing was viewed as extraordinarily effective. It's been suggested that CoQ10 benefits oral health by reducing the oxidative stress associated with low-grade inflammation of gums and bones. What I'd like to share with you now is sort of my own oral hygiene protocol, so to speak. This entire presentation was put together because I went to the dentist. I have pretty decent teeth. I don't have cavities and things like that, but I was diagnosed with gingivitis, which I knew was inflammation of the gums, and when it's inflamed and it's inflammation, it's infection. So gross, right? Because that's very dangerous. We just saw why that is so dangerous. So I went on a quest to figure this out. So my sole goal was to go back to the dentist 6 months later and her give me a raving report. Well, that's exactly what happened. So I went back to the dentist 6 months later. She's like, oh my gosh, I have never ever seen such a drastic, difference from the last time someone's been at the dentist. You've got to tell me exactly what you've done. So I went about telling her exactly what I did, which is what I'm going to share with you right now. Now, I use a Sonicare toothbrush, but I've always used one, as long as they've been out. So, I think for me, the toothpaste is kind of a big deal. I don't want to get into it here, but I try to use toothpaste that are free of fluoride and obviously sodium lauryl sulfate. We don't want that. So this is one that I've discovered and I love it. It's a salt toothpaste. I have to order it from Amazon. It's by Weleda, I believe is the name of it. But anyway, it's free of synthetic preservatives, flavors, colorants, raw materials derived from mineral oil, surfactants, and fluoride. And surfactants for them means sodium lauryl sulfate. It increases natural saliva production, encouraging the body to keep gums clean, healthy, and strong. It has extracts of myrrh and ratania that help tighten the gums texture, which is important for me because when you have gingivitis, you're going to have some deterioration of your gums. So it is a mixture of essential oils, including peppermint, and it provides a long-lasting freshness. So again, free of surfactants and fluoride, which is the sodium lauryl sulfate. The next thing that I incorporated was something that I saw a review of and I thought, you know what, I'm just going to give this a try and I love it. So I'm going to tell you a little bit about it. It's not something that I think everybody should just run out and buy. It's kind of pricey. It's called an Imident, and it says in comparison to other toothbrushes, Imident Ultrasound, and that's what it uses is ultrasound, destroys bacteria and germs in the most difficult to reach areas where bristles and floss can't reach, with up to a 12, millimeter deep inside the tissue, protecting your teeth, gums, roots, and implants. And actually, it's a no brushing toothbrush innovation. And again, it uses 100% ultrasound to clean. No pain if you have sensitive teeth, and even receding gums. And that's what sort of sold me on it because, again, I had one little area where my gums were starting to recede. Now, if you do look into purchasing an Imident, let me just say that the toothpaste that you see in this picture, that is not the one that I use. That's the one I use. And when I first bought my Imident, they didn't have this available. But this is the natural toothpaste, and it does not have any parabens and no fluoride. So that was really important to me. And then, of course, the next thing is what we've been talking about is using coconut oil. So let me just kind of refresh. I would brush my teeth, rinse that out, and then I would use my Imident. rinse that out, and then follow it with coconut oil and just doing the oil pulling back and forth. And guys, I'm going to tell you, probably didn't stay in my mouth 20 minutes, but I just made sure I got it on all, just throughout my entire mouth,